I appreciate that. Thanks for inviting me to speak today. I've kind of talked about Kratom before in one of our previous Echo sessions, but it was kind of tacked on at the end of some of the other items that we were talking about. Kratom is, as you can see from the title, attempting to understand the understudied. There's really a paucity of data on it, although if you look in the literature, and what I learned as I was looking through and reading more on it, more and more stuff is coming out as the years go on and as this becomes a more popular topic. So even since I gave this talk about a year ago, there's been more stuff that's kind of come out to understand it a little bit more, but it's still difficult. It's a difficult topic to cover. So I'm going to do my best. And knowing that there's not a ton of data out there, I welcome any questions that you all have, and also any input or experience that you all have at the end. If you just want to pipe in with that too, that would be great. All right, so I have no financial disclosures, objectives. At the end, describe what Kratom is, discuss why patients use Kratom, or Kratom. You can say either one. I like Kratom better. I don't know why I say Kratom a couple times. Kratom, and then identify safety concerns with Kratom use. So what is Kratom? So it is this plant, this tree that is in the same kind of family as the coffee plant. The leaves have been used traditionally. It grows in Southeast Asia. It is a tropical plant, and people have been using it for hundreds of years for a variety of different medicinal purposes. And it's just very commonplace in places like Thailand and Malaysia, and those types of places. So speaking of Asia, so Thai and Malaysian farm workers utilize it for multiple reasons. And so when they're out in the fields for long periods, this kind of helps get them going. It provides energy and a stimulant effect. It eases their muscle aches and pains so they can continue doing their work for long hours in a day. As long ago as the 1830s and 1890s, it was identified as a treatment for opium addiction, and also a substitute for opium if there was no opium available. People would use that. It had been illegal in Thailand until 2021, but it was still widely used because this plant grows just all over there. And so people would just grab the leaves off the tree and chew on them. There's a couple other ways that it can be used as well. You can dry the leaves, you can put it in a tea, which we'll talk about later. Drinking it through tea is one way that it's routinely consumed. And it remains illegal in Malaysia, but again, it is kind of endemic to that area, the tree is, so people do use it as a substance. So, sorry, I went a little too far. So here in the United States, it really popped up and started to become a thing. It got hot on the internet and discussion forums in about 2005 as kind of a natural treatment for opioid use disorder or opioid withdrawal. And so this is not something that was put out there by, medical organizations or the CDC or FDA or DEA or anybody like that, but on, different forums and drug use forums, it was coming up, and that kind of goes in conjunction with kind of as the opioid epidemic was exploding here in the United States. So the DEA did take notice in 2006. They actually made a recommendation that Kratom become a Schedule I drug here in the United States, but there was a delay on that vote, and that has still yet to come to fruition. There are some large organizations that are kind of for the use of Kratom that are trying to get more information out there about it, and those types of things. And we'll talk about why that might be moving forward. So it still hasn't been ruled on, and it remains by the DEA a drug of concern. It is illegal in several states. You can see on this map here. In red, it's illegal in those states. Purple, there's some pending legislation, and green, it is legal. So of note, in Tennessee, it is legal. However, there are some stipulations on it. It must be in its natural form, and it must be labeled. And so I did read some articles about different people that, if there's like green powder or something in somebody's car when they got pulled over, they've been arrested for illegal use of Kratom as it wasn't labeled, and there was no way to know whether it was a synthetic Kratom or it was natural Kratom, that type of thing. And then you must be 21 or older to buy or possess in Tennessee. I did call, traditionally you would think about buying this. I mean, I feel like a few years ago, you could go into any gas station and see Kratom all over the shelves. I haven't seen it quite so much, and maybe other people have, but I did call a local tobacco shop to see if they carried Kratom, and they do not. So I just thought that was interesting. I only was able to call one here in Johnson City. So how's Kratom used? Like I said, a lot of people put it into a tea and drink that tea. It could be by chewing the leaves. It's been kind of dried, made into a powder, and then put into capsules. You can smoke it, but that's not common. In Thailand, it's common. This 4x100 cocktail is common. So that's got Kratom, caffeinated soda, dextromethorphan, codeine, and diphenhydramine, along with ice, which sounds like a pretty powerful cocktail, if you ask me. But they use that a lot. I've heard that soldiers, I read in one article that Thai soldiers use it a lot to remain kind of like alert and on their game. Although you've got a lot of different like stimulants, but also things that kind of depress you or are kind of downers. And so I would think that it would just be like a chemically confusing concoction for sure. Street names are listed here. I'm not sure if you pronounce that Thang or Tang, or Tom or Thom, but those are a few of the street names listed. So who uses it? The statistics are still kind of coming out, and even the data that we have is not super great because like SAMHSA and places like that, I don't even know if they're starting to report on it yet. And so we kind of have these smaller studies that are recruited online, which can introduce some biases. We can see, so this is a study, these studies 2017, 2020, and 2021. The first one was an online survey recruited through multiple social media and online resources, primarily via the American Kratom Association. So definitely a little bit of bias there. In the 2020 study with Schimmel and colleagues, was looking at the non-medical use of prescription drugs program, and they recruit people through basically people that take surveys online for money, which could kind of self-select for a certain number of people. They did only enroll, they enrolled patients that would estimate the population or represent the population of the United States at that time. So they did try to eliminate some bias that way. However, there's still some issues with that. And then on this last one in 2021, they recruited their respondents through Amazon Mechanical Turk, which is basically another thing where people get online to make money doing various tasks, surveys, all kinds of different things. You can see the number of those patients ranged from 1,500 to 8,000 in the different ones. What we're finding with the characteristics of Kratom users, and it looks like maybe this is changing over time, or maybe we just don't understand because we don't have great data yet. And also another thing to think about is a lot of times people that take online surveys and things like that might be of the younger generation as well. So it's kind of hard to say whether these are super representative, but this is the data we have. So in 2017, it was middle-aged, middle-income people. By 2020 and 2021, we're looking at younger, male, unpartnered, no children. Of note, in the 2020 Schimmel, their DAS scores, they got their DAS scores and they were more substantial and severe in people with Kratom users. What we can see from these other findings is, interestingly, so in the 2017, they said the indications that people said they would use it for would be pain or emotional or other mental conditions. For the United States, estimated prevalence in the past year of use, in 2020, it was about 0.8% of the population estimated and 1.3% lifetime prevalence. And then the thing that I think is really interesting is that the strongest predictor of Kratom use was use of other drugs, with the strongest being cannabidiol, second strongest psychedelics, and third non-medical prescription opioids. So usually, and what we've seen too in overdoses involving Kratom is that often there are multiple substances present and not just Kratom. So that seems to be a trend that we're seeing. Effects of Kratom and why people use it. These are self-reported. So low dose gives some stimulant effects, higher dose, a sedative effect. There can also be some analgesic effect and some euphoria, although in the reports, the euphoria was less than the euphoria from using prescription opioid drugs. One thing we want, or a few things we want to worry about: liver toxicity. This is still not a causal relationship that's been established, but something that they've seen, especially at higher doses of the kratom. And again, because it's usually polysubstance, it's hard to say for sure whether it is the kratom causing it or not, but it does seem to be, it does seem to kind of coincide with kratom use. Seizures at very high doses. And then interestingly, they took some cardiac muscle stem cells and added one of the active ingredients. So I should have probably talked about this earlier, but kratom is, a plant that's composed of a bunch of different compounds. And two of the ones that most often come up are mitragynine and 17-hydroxymitragynine. And these are the compounds that work specifically on opioid receptors, which we'll talk about in a while. But when mitragynine was given to these cardiac cells, basically it would prolong their action potentials, which could lead to increased QTC interval, which we see a lot, increasing the risk for torsades and other arrhythmias. Because those were in vitro studies, we're not 100% sure whether that translates to humans, but a couple of case reports kind of did indicate that when they did get EKGs. Common adverse effects: there is dependence that goes along with it, anorexia, weight loss, insomnia, dry mouth, constipation, hyperpigmentation of cheeks can happen, frequent urination, and decreased libido. One important finding that's not on here that we don't see, especially as this we'll talk about has some opioid agonist mechanisms, is that doesn't seem to be correlated with respiratory depression. And that's because basically once these opioid receptors are activated, there are a couple of different pathways they can go towards. One is called the beta-arrestin pathway, and that is what is thought to lead to respiratory depression. And for some reason, mitragynine and 17-hydroxymitragynine tend to avoid that particular pathway. So, all right, with dependence, can help with opioid withdrawal, but it can also induce its own withdrawal. So it mitigates the effects of opioid withdrawal in people that are withdrawing from opioids. But when I say induce its own withdrawal, if people become dependent on kratom and they stop kratom, they will still have withdrawal effects, which are listed here, similar to the effects that you would get withdrawing from opioids. Also, it's been reported in several studies that patients will use higher doses over time to get the same effect that they got before. All right, mechanism of action. It is a partial opioid agonist at mu receptors. It is an opioid antagonist at kappa receptors. Delta, there's a lot of conflicting data. On top of that, kratom has agonism at alpha-2 receptors, which is kind of the receptors that we will sometimes utilize to when patients are to mitigate some of those side effects of the opioid withdrawals. And it can also inhibit cyclooxygenase 2 or COX-2, which leads to inflammation in the body. So by inhibiting that, we're reducing inflammation as well. So these are some reasons, some mechanisms behind the reasons that patients might use this substance. Drug interactions, these are actually really scary. We don't understand these completely. It's an inhibitor of several CYP enzymes, which are what metabolizes a lot of different medications, including a lot of opioid agonists that we have. So we've got CYP 2D6, 2C9, 3A4, 1A2. For my pharmacists and other clinicians that are really familiar with metabolism of drugs, this should be like ringing a bell. A lot of medications go through these pathways. And so inhibiting these can lead to buildup of these of the drugs, leading to toxic effects. It also inhibits P-glycoprotein, which also helps to get rid of medications in the body. Conversely, what we've also found is that there may be some upregulation of these CYP enzymes based on a different mechanism of kratom, as well as the P-glycoprotein. And so it's kind of like, all right, we're upregulating these enzymes, but we're inhibiting them. So how does that actually play out when we see these? There was one case report of an accidental overdose. The patient was on quetiapine, and the concentrations in the blood were were really high. And they did a pill count of the patient's prescription. It didn't look like he had overdosed at all on that. The mitragynine and 17-hydroxymitragynine concentrations were also elevated in the blood. So they thought that there was a drug interaction here leading to the buildup of the quetiapine, which eventually led to the patient's death. All right, so we have kind of hit some of the high points, hopefully not gotten too much into the weeds, but as a summary, kratom is this plant in the coffee family being used to treat, being used off-label for opioid use disorder, and also opioid withdrawal. Sometimes people use it for chronic pain. Some people use it for emotional distress or psychological conditions that they're not getting treated in other ways. It's not well studied or understood, has significant drug interactions. It's not regulated, and since it's not regulated, could be adulterated. So a lot of times when they look at, when they will take samples and analyze them in the lab, they can see that there are other substances in there, such as MDMA, sometimes fentanyl, all kinds of other things. So what questions can I answer for you all?
I have a quick question. What's the penetration locally? Have you seen, and how is it picked up on a urine drug screen?
So it is not picked up on a normal urine drug screen. You would have to specifically send out for the metragenine or 17-hydroxy metragenine levels. And I don't even know, I didn't get a chance to look to see how easy or difficult that is. But basically that's one of the things they talked about in the literature, is that it's really difficult to know. And a lot of providers don't even think about kratom as a substance being used. So they might not screen for it. So I don't do as much work with our addiction medicine team to see that, but I wonder, Dr. Troxler, have you all seen much kratom use locally here, and do you all screen for it very often?
As you said, Ryan, it's not something we can get on the urine drug screen. We've not sent anybody trying to get the substance chemical names that you just said, and I'm not going to attempt to repeat. The fact that they roll off your tongue like that, I am duly impressed. But just by patient report, and we've not had many people tell us that they are using that or dipping into that whenever they've run out of their medication or they've come to it on us. We will get it sometimes in history, but most of the time they're reporting not current use. And again, I don't know if that's part of comfort level and disclosing how much maybe they are relying on it or not. But it's definitely out there. You can see it in the convenience stores. Gas station convenience stores.
One thing that I noticed, and I meant to put into the slides, and I didn't really, I think I had it in my notes, but I didn't have presenter view because I just have my laptop, is that a lot of the surveys that they have done in Southeast Asia of people that use it regularly, they don't report that they have had to seek medical attention around kratom. They haven't been hospitalized for anything having to do with kratom. They have been able to go and be kind of productive members of society, continue to work, continue to hold down a family and a job and all of that. And that they say it doesn't negatively impact their lives. Now, again, that is great. And that sounds like it would be awesome. Some of those side effects we saw were really scary, right? So the FDA right now and kind of the DEA, where they stand is this has some, potential, there are some compounds within kratom that potentially could be beneficial in the future, but we do not know right now what the safety is of these, safety and efficacy, short-term or long-term really, because we just don't have, a lot of our studies are just kind of like surveys of people in these different areas or case reports of toxicity or overdoses, which we've seen increase significantly since 2005. So those calls to poison control centers continue to increase and increase and increase as the years kind of go on. There is, I started to dig into it, but I didn't get a whole lot of time to read. There is a subreddit that's devoted to kratom. So if you want to go and read what people are putting on there, what they're saying about it, what their experiences are, they are heavily advocating, kind of like the marijuana community, I guess, of like, here are the benefits, here are the things you need to watch out for. Obviously, they're biased because they are leaning towards kratom. But I do think that this is an area, that merits more research and would be really interesting to see when used in a controlled environment.
And David Rowan also put up there, and he just provided the link for it, that it's contaminated with pretty heavily with some heavy metals like I think nickel and lead is what he said in the chat. And as promised, Rick has put a number of articles in the chat, so check those out, because there's actually one which I want to pull and look at. I want to pull all of them and look, but there was one specifically on impact on pregnant moms and kratom use. So I definitely want to pull those. Those should show up in our resources as well when you go on our webpage. But one thing that I found interesting is that in some ways it acts a lot how buprenorphine does, because it's a partial mu agonist and an antagonistic kappa, and that's exactly the pharmacologic profile of buprenorphine. So that is interesting.
Yeah, like I said, I mean, I feel like there is potential. It'll be interesting to see if the research happens and people start to do it, which when I was reading through some of these articles, and I should have gone to clinicaltrials.gov, but it would be interesting to see if these studies are happening or not. Some of the articles I was looking at were like, we looked at clinical trials and there is only one trial listed under clinicaltrials.gov that is ongoing or will be working towards this. So, and obviously there are some ethical concerns, right? If you worrying about some of those adverse reactions, but if we never study it, we're not going to know. People are going to continue to use it and seek it out unless it's, even if it does become illegal. So it'll be interesting.
Yeah, one thing we've definitely learned, it doesn't matter whether it's legal or not.
Right.
People think it has a purpose, they will use it.
I didn't have a question, but I did have a comment. We tested for it in our outpatient clinic. We're out of test strips right now, but there is an additional strip that you can buy for kratom, and that's what we use, but we didn't see it very often. We had a few people that tested positive since I've been here, but not very many.
I think
They
it
were
might.
able to. Oh, go ahead, Ryan.
I was just going to say, I think it might be more difficult to find. I read a couple articles from Tennessee that were like, this is such a gray area in the law that people are not willing to take the risk. A lot of people are not willing to take the risk going ahead and selling it. And as Dr. Rohn said, he did see some advertisement for it in Elizabethton. But again, I remember seeing it on the shelves in gas stations, but I also haven't been in gas stations too much recently with COVID, to be honest. But it just doesn't seem as readily available as it used to be.
Suzanne, do you mind telling us where you got those test strips from, and were they point of care test strips?
They were. I'll have to ask my medical assistant if she knows. I don't know.
Okay.
Yeah,
okay.
But I will ask. I'll see.
Okay, I would be curious to know, because those one point of care tends to be far more affordable than when we send in for confirmation, and
For sure.
confirmation, especially for something that specialized, would probably be far more expensive. But that knowing when you know in the room with the patient is really nice, instead of waiting for results to roll in a week later.
Yeah, I'm gonna run across the hall and check with her real quick and see if she knows. Okay.
Awesome. Cool, Suzanne. Thank you. Other questions or comments?
I had a comment. I was just thinking that like the novelty of the kratom mechanism and the potential benefits of it almost link it into these or similar to the new psychedelics that are being studied for addiction and in mental health issues, in a sense that if it becomes illegal, then there goes all of the knowledge that we could gain about it. So I don't know. It's interesting how the legalization or criminalization of this product will impact the therapeutic uses of it in the future.
Yeah, absolutely. That's a really, really good comment. And another comment on legality is that I shared that list of the map of the United States, but even within certain cities have criminalized it or made it illegal, certain counties have. So it's really kind of a hodgepodge. And there's not even really a good spot that I've found to go to find like, here's where it's legal, here's where it's illegal. It was difficult to even find, I found that map, but that was most recently updated in 2020, like in August or something. So, we're still delayed, and that could be somewhat behind as well.
Fabulous presentation, Brian. We really appreciate it, because it is an interesting topic, and one of those, just kind of as you had titled it, kind of like the forgotten substances that we need to be thinking about and asking our patients about.